Your Excellency, I'm here with members of the Gender-Based Violence Migrant Committee, who you very kindly reconstituted exactly 1 year ago in this room. Over the past year, we have been working on a number of issues to ensure that Ekiti State is able to have a robust GBV response. When we are talking about GBV responses, there are usually 5 issues to be taken into consideration. First of all, creating an enabling legal and policy environment. Second, the provision of treatment, care, and support for GBV survivors. The third is education and sensitization for GBV prevention. The fourth is community engagement and awareness raising to encourage ownership and involvement in grassroots communities. And the fifth is the existence of a coordinating mechanism made up of statutory bodies as well as civil society organizations to ensure sustainability of all the above measures. Your Excellency, I'm pleased to report that over the past year, the Ekiti State Coordinating Mechanism for GBV issues, our Gender-Based Violence Migrant Committee, has worked effectively on all these 5 areas. Even though the COVID-19 crisis slowed down our work in the year 2020, on the whole, over the past year, we have been able to achieve a number of things, and I'll briefly highlight some of them. First of all, we have been able to accomplish, with your support and the support of the Ekiti State House of Assembly, the speedy passage of the revised Ekiti State GBV law, October 2019, by harmonizing the previous Ekiti GBV law 2011 with the 2015 Violence Against Persons Prohibition Act. Ekiti State now has a stronger GBV law, one of the strongest in the country. We have also been able to get the compulsory treatment and care for sexually abused minors law of 2020 passed and signed by you, the first of its kind in Nigeria. And this was signed into law by you, Your Excellency, on the 5th of June, 2020. Through the office of our able Attorney General, the Sex Offenders Register of 2013 was reactivated in 2019. In addition, Ekiti State now has a name and shame policy, which publishes the names and photographs of convicted sex offenders in the state. Again, at the risk of sounding immodest, the first of its kind in Nigeria. The Attorney General has also introduced a Victims' Charter, which outlines the rights of victims and survivors of GBV in Ekiti State. This committee has also been able to undergo training for members because we believe in order for us to carry out our mandate effectively, we need to know what we are doing and what we are talking about. So the GBV Migrant Committee members have received training. The GBV Migrant Committee has been working on treatment, care, and support of GBV survivors through the use of a temporary shelter known as the Ekiti State Social Intervention Center, run by the Ministry of Women Affairs and Social Development. A permanent site for the state shelter is currently underway and will be ready for commissioning within the next 3 months. And we'd also like to add, Your Excellency, that we have developed comprehensive guidelines for the running of this shelter in accordance with global best practices. The GBV law of 2019 makes provision for a survivors fund. I don't need to add for the first of its kind in Nigeria, but it is. Since December 2018, this fund has been able to support at least 133 GBV survivors with rebuilding their lives. Examples of assistance include renting accommodation, starting businesses, paying school fees, and other needs as determined by survivors. Over the past couple of months, the Gender-Based Violence Management Committee has embarked on a series of advocacy engagements with various stakeholders, such as the Chief Judge, Attorney General, Council of Traditional Rulers, the Nigerian Interreligious Council, the Commissioner of Police, Chairman of all local government areas, Ekiti State University, the Head of Service, school principals, media chiefs, and heads of ministries, departments, and agencies, and several others. In total, we have carried out 20 advocacy visits, and we also received courtesy calls for some bodies as well. The outcome of these visits has been very promising and will go a long way in ensuring the much-needed community ownership of GBV responses. On Tuesday, June 23, 2020, the Ekiti State Sexual Assault Referral Center, SAC, known as Moremi Clinic, was launched at Ekiti State University Teaching Hospital. The Moremi Clinic is a one-stop, free, survivor-centered initiative that prioritizes the rights and needs of survivors of sexual violence. The SAC has emergency response, medical, legal, counseling, police, and community outreach teams. This enables the SAC to provide prompt medical treatment, collection and analysis of forensic evidence, counseling, and psychosocial support, as well as legal services. On June 5, 2020, Your Excellency challenged the GBV Migrant Committee to come up with a state emergency action plan on GBV. Your Excellency, today we are here not only to present our annual report, we are presenting our GBV Strategic Framework 2020 to 2022, which has a range of short to medium-term interventions. In the spirit of the state of emergency on GBV, which the Nigeria Governors Forum declared on June 10, 2020, indicating the required political will, we have a number of things to ask Your Excellency the Governor to enable the smooth implementation of our assignment. The requests from the Gender-Based Violence Management Committee, Your Excellency, are as follows. We have 10 requests, sir. Number one, we would like Your Excellency's kind approval of the Ekiti State GBV Strategic Framework 2020 to 2022. Number two, we would like Your Excellency to kindly include gender-based violence issues on the agenda of the State Security Council meetings, because we believe that GBV issues need to be discussed at the highest levels possible as a security concern. Number three, Your Excellency, sir, we humbly request that you appoint a part-time gender-based violence research and documentation specialist to aid in data collection for analysis, planning, and service delivery. Number four, we would like you to please provide appropriate measures for the recruitment, retention, and capacity building of social workers, gender specialists, and other relevant staff in Ekiti State. Number five, based on some of the things that we have observed and some of the feedback we have received, we would like you to kindly initiate a review of our mental health facilities and resources in Ekiti State to aid in our GBV management programs, as well as facilities and resources to care for women living with disabilities, because these categories of women are vulnerable to gender-based violence. Number six, Your Excellency, sir, even though we have met with local government chairmen, we would like you to please encourage all local government chairmen to support our strategic plan as it applies to their respective local government areas, particularly the establishment of a shelter in each local government area and a sexual assault referral center in each senatorial district to begin with, and eventually each local government area. Number seven, even though we know that your administration considers women's rights and women's economic empowerment a priority, we'd like you to please lay more emphasis on the prioritization of women's economic empowerment and livelihoods to reduce the vulnerability of women and their children to gender-based violence. Number eight, we would like you to kindly allow us to include some additional bodies as members of the Gender-Based Violence Migrant Committee. We would like to include the National Human Rights Commission, the National Agency for Prohibition of Trafficking in Persons, NAPTIP, and Civil Defense on the GBV Management Committee. Number 9, we would like you to kindly, even though we paid visits to all the relevant MDAs to their heads, we would like you to please ensure that all commitments and promises made by MDAs and other stakeholders are kept by affirming a zero-tolerance position on gender-based violence. Now, Your Excellency, I'm sure you'll be wondering when we are going to ask you for resources or for money. We are going to ask you, sir, that is the 10th, and we are going to ask you 8 times. So, we would like you, sir, to please provide adequate financial, human, technical, and material resources for the implementation of the GBV 2020 to 2022 strategic plan, broken down as follows. Number 1, as in 10.1, significant support for the Ministry of Women Affairs and Social Development, which is the Secretariat of the GBV Committee. 10.2, increase support for the programs of the GBV Committee, particularly in training, community advocacy, the Survivors Fund, and knowledge management. 10.3, ensure that the statutory members of the GBV Committee have a budget line item provision for GBV programs, specifically the Ministries of Justice, Health, Education, Information, and Local Government. 10.4, we would like, sir, a budget for the running of the newly established Sexual Assault Referral Center, the Moremi Clinic. 10.5, we would like you to please, sir, kindly increase the monthly allocation for the state shelter, known as the Ekiti State Social Intervention Center, taking into consideration the expansion of the shelter when it moves to the permanent site. Currently, the shelter that we are using is able to accommodate up to 30 women and their children. The new site is going to accommodate well over 100 women, so we are going to need additional support. 10.6, we would like you to kindly provide resources for the furnishing and equipment of the permanent site for the state shelter, which will be operational by October 2020. 10.7, we would like you to please support the Gender and Vulnerable Persons Unit located with the Office of Wife of Governor in partnership with the Ministry of Justice. And last but not least, 10.8, we would like you to kindly give monthly subventions for 6 organizational members of the Ekiti GBV NGO network to ensure sustainability. And I'd like to emphasize, Your Excellency, that this request did not come from the NGOs. The request has come from us on the committee as a recommendation to you, sir, to ensure that whatever happens in future, we have a strong cohort of civil society organizations in Ekiti who are able to do GBV work effectively. Your Excellency, sir, we are grateful for the opportunity to be a part of this critical assignment. We will continue to do our best with continued support and political will, the commitment of various stakeholders, and God's grace. Thank you once again, sir, and God bless.